Hello and welcome to the Parkinson's Foundation's Wellness Wednesdays webinar. The Parkinson's Foundation is a dedicated nonprofit organization committed to enhancing the lives of those living with and impacted by Parkinson's. We focus on improving care and advancing research, ensuring that all our efforts are closely aligned with the needs and priorities of the Parkinson's community. Most people with Parkinson's disease will experience changes in speech, voice, and swallowing at some point during the course of the disease. Today, we will learn tools and exercises to help us better understand and manage speech, swallowing, and communication challenges in Parkinson's. To begin our formal presentation, I would like to introduce our presenter for today's webinar. Carrie McBreen is an adult medical speech language pathologist with 29 years of experience. She's the owner and a practicing speech language pathologist at Lake City Speech and Voice Therapy, PLLC, a private teletherapy practice focused on adult voice, speech, and swallowing disorders. Carrie proudly serves the veteran population at a Chicago area Veterans Affairs Hospital, where she is an SLP and the clinical speech specialist in voice and gender affirming voice services. Throughout her career, she has focused on treating people with Parkinson's disease and has gained certification in LSVT Loud, Speak Out Therapy Program, and is trained in respiratory muscle strength training, speech vibe, and other device facilitated swallowing treatments. Carrie is a Parkinson Foundation team training alumni. Carrie, thanks for sharing your time and your expertise with us today.
Hi there. Thank you so much for having me. Pleasure to be here. Let me start my slides. All right. Does that look okay?
I can see your notes.
Oh, okay.
Display.
Let's see here. There we go. How's that?
Oh, strange. I can still see your notes.
Oh. Should I unshare and try
Yeah,
again?
tap share and then we'll try again.
Okay.
Patience, friends. There's always
Bear
You're
with
fine, Fred.
me. Sorry.
All right, Fred and Patsy from South Carolina, welcome. Hi, Ruth from Illinois, Laura from Texas, Jean and Pat from Iowa. Welcome, Michael from Indiana. Hi, Jagdeep from London, UK. That looks great, Carrie. Thank you so much.
All right. Great. All right, well, let's jump in and get started. A little bit about myself. So I am a speech language pathologist. I've only worked in the adult population since I became a speech language pathologist. I've worked in many area hospitals in the Chicagoland area and recently opened up my private practice. So focusing on speech and swallowing and voice. I have a few financial disclosures. I am the owner of Lake City Speech and Voice Therapy. I do receive a salary from the Jesse Brown VA Hospital, and I am also a product design consultant for Progia Medical, which is a device that I will mention later in the presentation, along with some other devices. Okay, so let's talk about what a speech language pathologist does. We're licensed healthcare professionals, and we really are skilled in evaluating and treating a variety of problems that may come up. So communication could include your speech. So speech meaning how you articulate the sounds, voice meaning how the sound is generated in your voice box, and language is really about how you choose the words that are kind of like a higher level within your brain and how you then speak them out. Swallowing, respiratory strength, and cognitive communication are some other things that we can focus on. And we're going to go into depth in all four of these areas and really talk about what you might see and why you might need these things, and then also some strategies that we might use in each of these areas. So when we think about treatment for people with Parkinson's disease, we can think of it as rehabilitation, which is restoring an aspect of someone's health or communication, swallowing that has been impaired, and we're trying to make it better through therapy. But more recently, there's been a concept of prehabilitation, which is really about maintaining or preventing decline in function. So being proactive, sometimes at the first sign of change, even if you're not feeling a huge impact in your life with something communication wise or swallowing wise, you may want to actually seek out some treatment so that you can maintain the function that you currently have and that it doesn't decline as quickly. Let's talk about communication first. So the communication symptoms that are very common with people with Parkinson's are reduced vocal volume, weak or a breathy voice, or a hoarse voice. So you may have just signed some sort of change or weakening of the voice, or it could also be rough, kind of a rough, gruff kind of voice quality. So anytime you have any kind of vibration changes to the voice, you can get a change in the quality of your voice. It could be slurred or mumbled. You could have monotone speech, which means that the pitch of your voice becomes very even and equal, and you don't have a lot of up and down in your voice, which then kind of reduces some of the emotion in your communication. Other people might experience disfluencies or stuttering. That's called palilalia. Palilalia is really happens because there's an incoordination in the lips and tongue when you get started speaking typically. And then one of the things that I think I hear almost every single time I evaluate someone for communication difficulties is that they say they have to repeat themselves often. And so a lot of times that's one of the only things that they realize, because the biggest thing that you can see in Parkinson's disease is oftentimes that the perceptual system can be kind of broken. And so the person with Parkinson's does not realize that their volume is low or that their speech is becoming slurred or mumbled or monotone. A lot of times they hear themselves in their ear as speaking totally normally. And so sometimes that can also be a reason that there's a delay in treatment, because if you don't perceive a problem, you might not seek the treatment that you need. Let's talk a little bit about symptoms of swallowing problems. So first and foremost could be coughing or choking, things going down the wrong pipe, if you will. You could also have a sensation of things feeling like they get stuck in your mouth or throat. So after you swallow, it feels like not everything has gone down. Oftentimes you can also have trouble just coordinating the movements to get the food or the liquid out of the mouth. So sometimes people will experience almost a rocking of the food or liquid in their mouth before the muscles coordinate to allow that reflex to trigger. Avoiding eating or drinking. So sometimes people just avoid the act of eating or drinking if they don't really realize that they're having difficulty swallowing, but their body is sort of sensing that they have difficulty. Weight loss can be another sign of swallowing difficulty. Drooling or foods or liquids coming out the nose. And when you're having foods or liquids coming out the nose, oftentimes it's a problem with the soft palate where it doesn't lift up to close off the nasal passage. And two types of evaluations that you can receive are, one is called a video fluoroscopic swallowing study, and you can see here that this dark material here is the barium that you'll be swallowing, so it lights up on x-ray. It's like a moving x-ray of the swallow, so a speech pathologist can see in real time the food transporting from the mouth to the throat and then into the esophagus, and then looking also to see that there is nothing going down the wrong pipe or into the airway. And as well, we look for anatomical changes and things like that. This is not necessarily a study that looks at the anatomy as much as it looks at the physiology of the swallow. So the physiology of the swallow is really how the swallow functions in action. And then there's also fiber optic endoscopic evaluation of swallowing. So with this study, we might choose this study because we want to see maybe over time how someone is doing. With a video fluoroscopic study, we're limited because it's X-ray exposure. And so we try to complete the study as quickly as we can and reduce the amount of exposure time. But we do like to, evaluate different parts to try to mimic a meal, but it is much shorter than an endoscopic study might be because we might be looking for things like fatigue or, things like that with an endoscopic study. So, and here you can see this green material here. This is actually dyed, I'm going to guess and say probably applesauce. And so we dye the material so that it doesn't sort of blend in with the anatomy. But what we're looking at here, this is our epiglottis, which is a cartilage. And then we're looking at our true vocal folds. Here's our trachea. And then we're looking at our false vocal cords and our arytenoids. All of these things are parts of our anatomy within our voice box. And then this is the throat. And here is the entry to the esophagus. So you can see that if material here isn't clearing through the throat, it is able to spill in right here into the windpipe or voice box. Another form of swallowing evaluation you might receive is called a clinical evaluation. So if someone doesn't feel like if your speech pathologist does not feel you're having significant difficulty, they may just evaluate you in office, or if you're in the hospital at your bedside, watching you eat a meal and evaluate you in a more clinical sense. Whereas the fluoroscopic study is a moving X-ray and it looks at the function of the swallow again, and fiber optic evaluation, they're basically putting a small scope into your nose that dangles in your throat and they watch you eat a meal. This one looks a little bit more closely at the anatomy of the voice box and it makes inferences about your swallowing, whereas the video fluoroscopic study, you get a little bit clearer picture of the whole swallow. Let's talk about how respiratory strength plays a part in difficulties in communication and swallowing. Oftentimes a weak voice, an ineffective cough, or reduced airway closure can be caused by the muscles stiffening. And as the muscles of the swallow or the voice stiffen, they don't move as well. Just like other parts of your body may stiffen with Parkinson's disease, you may find these things happening in your voice box, or you may find them in your cough strength. So if something were to go down the wrong pipe, you don't have enough strength to cough it up. You may also have difficulty in closing your airway off. If your airway is not closed all the way, it can create a little opening where when you're swallowing, things can kind of sneak through and go down the wrong pipe. So using respiratory strengthening, and we're going to talk about what that is shortly, can help to strengthen the muscles of like lower down in your intercostals and in near your rib cage, and that's really where the breath support starts. All right, let's talk about cognitive communication. So some common things that are often complaints can be things such as memory difficulties, forgetfulness, not remembering where you put things. Sometimes there can be a lack of organization. There could be word finding difficulties where you have trouble formulating your thoughts. reduced attention to the task that you're doing. So sometimes just in the middle of a task, kind of forget what it was the end goal is, and reduced motivation or drive, which can be a big complaint with the Parkinson's population. A lot of times when working with families and caregivers of people with Parkinson's, we think about this motivation and drive piece because oftentimes, caregivers can feel as though maybe the patient just isn't doing enough for themselves. But really, some of that motivation or drive comes from a lack of dopamine, which is a neurotransmitter that communicates within the body to give messages to the brain. And so that motivation piece sometimes is really more of a chemical reaction than it is just a lack of wanting to do. However, there are things that you can do to try to compensate for some of these cognitive communication problems. And let's talk about what some of these treatment options are. So for starters, there are two main programs that I would say work on general communication, speech, voice. One is called LSVT Loud, and the other one is called Speak Out. They are very similar in the elements that are practiced, a little bit of change to the delivery of each one. So LSVT Loud was definitely the first program that came about and has a huge body of research behind it. And typically it is delivered 4 days per week for 4 weeks, or at least 4 weeks. So it's very intensive. It's personalized to the client's interests. So if you're interested in golf, maybe some of the stimuli material that we'll be talking about will be golf related, because if you're working on something that connects with you and something you're interested in, that can help you to carry over some of the strategies into your day-to-day life. There is a follow-up program to the LSVT Loud called Loud for Life. So that is sort of the program that you would do after you completed the individual therapy with the therapist. They also have a paid subscription model for a virtual Loud for Life. It was developed in 1987 by Lori Ramig et al. And they now also have a partner program for LSVT where it's for your physical ability. So it's called LSVT Big, and that would be something you would seek out from a physical therapist. Speak Out is a little bit newer. It was developed in 2010. And so this program is typically delivered 3 days per week for 4 weeks. Sometimes if, let's say, the patient is really good about doing things on their own, you might be able to do 2 days a week. So there is a little bit more flexibility in the Speak Out program. They work on a pay it forward model for their clients. So anybody who is working with a trained Speak Out therapist can receive a client workbook. And that workbook is something that you get to keep. They ask you when they send the workbook out to you, if there is something that you can put in an envelope to pay it forward to the next client to receive a workbook. They don't tell you if it's $1 or $100 or a larger donation. They're just asking you to pay it forward in some way based on somebody else paid it forward for you to receive your workbook. In this program, there's a built-in cognitive component added to the program. I personally like the cognitive component because it helps you to learn the skills of increasing your speech intent or volume. And that intent or volume really needs to be practiced while you're doing other cognitive tasks, because that's really how you formulate language, you think about what you're going to say, and then you have to also monitor yourself about how you're going to say it. So you really need to learn to almost recalibrate your system, because oftentimes the system is stiff and it moves in smaller movements. And so that creates sort of that low volume, maybe a mumbled quality, or maybe there isn't enough drive within the voice box itself that creates that kind of weak vocal quality. And so these programs work on that premise of trying to increase volume or intent. Is it just shouting? Absolutely not. It's about recalibrating your ear to find that just right level that clears your speech up without it being damaging to your vocal cords. So it is really important to work with a speech therapist on this, because they can kind of help you to decide what that just right level is for you. And you can also really work to try to calibrate your system so that you are successful in the long term. Speak Out also has a loud crowd. They're now changing that terminology, and it's called the Speak Out Therapy Group. So the Speak Out Therapy Group is a follow-up program. So you can go weekly to a group. They also have free Facebook Live practice videos daily. So if you want to practice with someone every day, Monday through Friday, they have someone get on and do a lesson. And so you can work in a group setting where maybe some people don't like groups or can't attend a group because it's not near their home. You can always log on if you have some form of technology, so that you're able to practice along with a clinician. And then this one also has a very growing body of research behind it. Let's talk about why we need these programs. So this is a diagram of typically where you might find someone with Parkinson's speaking. So in the soft to very soft category, somewhere around there. However, the person themselves hears themselves in this normal loudness level, which is part of the difficulty in that perception piece, where everybody else perceives the speech as soft or very soft. The patient themselves perceives themselves as in the normal loudness range. And when they go to practice the programs, oftentimes they feel like they're loud or shouting, even though they're in that normal loudness range. So some of the program is really about getting the patient to understand that their loudness is not where they hear it in their ear, because oftentimes they don't have a good perception of what their speech sounds like. I always laugh with some of my clients, because a lot of times when we do the evaluation, they'll say, well, I'm here because my spouse has a hearing problem, but they think it's my speech. And if you know, like the number of times I've heard that, I would say, it's upwards of 3/4 of the people, because of that broken perception, they don't realize that people are not hearing them. They just feel that people around them aren't hearing them because of their own hearing loss. So let's talk about what the impact of increasing vocal loudness or intent does on the system. So when you're using sort of your daily speech, it might be soft in volume. Your articulation might be a little bit low or mumbled or slurred. The respiratory drive is low. The intonation might be monotone. the vocal cord closure within your throat might actually not be closing as good as it can be because of muscle stiffness or vocal cord bowing. And you might also see stiffness of the facial muscles, which causes sort of a masked expression on the face, as well as some difficulty with swallowing because there isn't enough squeeze or effort to squeeze the material through the mouth and the throat. With use of these programs, so after LSVT or Speak Out, they both work on a very repetitive kind of program that works on sustaining your volume, working on a vocal warm-up, working on gliding so that you get some flexibility in your voice box, so gliding up a scale and gliding down, and then working in kind of a hierarchy of increasing this ability to maintain intent or loudness, maybe starting with phrases, sentences, then we go to paragraphs, then we go to conversational things, and trying to maintain the loudness. I like to say to my patients that I really like to say, like, adopt this as a lifestyle, because as soon as you stop, it will decline. You really do need to maintain in the long term. That's why both programs have a built-in follow-up program so that it's designed so that you don't lose what you've gained. And those who have participated in the follow-up program do much better at maintaining what they've gained than those who just taper off. Okay, so let's talk about when we go to one of these programs, what happens? So we basically increase our volume or our intent. But what happens is when we increase this intent, we increase our articulation or the movement of our lips and tongue. Just by increasing the volume, it changes our articulation, our clarity, our intelligibility. Increasing our volume naturally increases our respiratory drive. So we take a bigger breath in. It increases our intonation. It actually gives us some melody back into our speaking. It improves the vocal cord closure. So when we get a better respiratory drive from below, as that air blows up through our vocal cords, we get a better sound quality. Using more muscle movement for this volume can also increase your facial expression. And there's been some recent studies that show that these speech programs have some effect on swallowing. Is it sometimes the only thing that's needed? Not necessarily, but if the problems are mild, sometimes it takes care of some of the issues that are happening with swallowing just by way of increasing the respiratory drive, increasing the muscle movement, all of which increases all this whole list of things. Another thing that we can think about with communication is there's a device, a wearable device. I think there's going to be more and more of this as technology advances. And wearable, devices are, I think, things that are probably on the horizon. This one is available and recently was approved by Medicare. It was designed, I believe it was Purdue University that someone there designed this wearable earpiece. And so it actually works on something called the lumbar effect, which is that when you are in a noisy environment, you naturally increase your volume. And so this earpiece you wear in one ear, and it looks almost like a Bluetooth headset, and it creates crowd noise in your ear. And so when it creates that crowd noise in your ear, it automatically increases the person's vocal volume. So this doesn't work for everyone. So going to get an evaluation would be a first start. They also have an app that can be used on, I believe, on Android and on Apple devices, that you can actually just take a regular old headset with your phone. So you download the app and you can actually do a trial where it kind of records your voice before you get the crowd noise in your ear. Then you put the your earbuds in, and then it gives you the crowd noise and then records your voice, and it kind of gives you information about whether or not you might be a candidate for this if you have at least a 3 decibel increase in your volume. That's said to be an indication that this might be a device you might want to try. Sometimes these are also used in combination with the other programs. We've been using this at the VA hospital that I work at for quite some time. I don't know how available yet they are in other clinics because I work at a VA hospital. We've been using it for a while, but the Medicare coverage just recently came into play. So I don't know the distribution of it yet, but you could certainly look on their website and see what clinics might be offering the device if you're interested. Okay, let's talk about things that you can do for respiratory muscle strength training. So respiratory muscle strength training is about really training the muscles of the lungs to work harder so that they can in turn help you to increase that volume. So if there's stiffening of muscles within our body, we can also get stiffening of these muscles kind of that help to inflate and deflate our lungs. So these are pressure threshold training devices, and you really want to work on a pressure threshold training device if you're going to work on respiratory muscle strength training. They work with centimeters of water pressure, and you actually will turn the top of this device for the expiratory muscle strength training, which is primarily what we work on in the Parkinson's population. And so you turn this cap, and as you turn it, it increases the amount of pressure required for a small valve to open at the top of the device. And so working on that, you would definitely want to speak to either your speech therapist or a doctor. There are some contraindications to doing this, so making sure you don't have any of those contraindications before you would try to obtain one of these devices. And it is better, I think, to work with someone who can help you to set goals and training goals for the device. Typically, it's about a 5-week program, and after about 5 weeks, you move to a maintenance program unless you're still slowly building muscle strength. Usually at about 5 weeks is the point where you start to plateau, and once you plateau in your muscle strength, then you just maintain that muscle strength by doing the exercises at a slightly lesser frequency. There's also an adapter that you can put. So you basically are putting, I don't know if you can kind of see this, but this cap actually goes inside of this tube, and then you just take this mouthpiece off, and then it becomes an inspiratory muscle trainer. So you'd have to buy these things separately, but for a few people, inspiratory training is really what they need. If they can't gain a big enough breath inward, or they're having trouble with getting a good breath in, sometimes this is something we might also recommend. And so you would also work on training similar. You would do a 5-week program, and then after the 5 weeks, if you've kind of plateaued and aren't making progress, and you kind of hit a plateau in increasing the strength on the device, then you would just continue to try to maintain that inspiratory strength. Okay, let's talk about swallowing. So swallowing, like we said, First starts with an evaluation, typically by a speech pathologist, so that we can actually visually see what's going on or clinically see what's going on. And from there, they might prescribe a course of exercises for you. The exercises might be kind of like physical therapy for the throat. So there are exercises, for example, you could swallow as hard as you can. So almost like doing a swallow of like thick and sticky peanut butter. As you swallow hard, you're exercising the muscles to try to move more than what they're moving because the muscles may be a little bit stiff or rigid. Other things, we target different areas of the throat. There are different set of exercises depending on what those visual exams show us, and that's how we would typically prescribe the exercises. There's also compensatory strategies, so things that we would do if let's say something is going down the wrong pipe. Sometimes there's a postural thing we could do, or a change to the diet. Maybe we make food softer, or maybe we take smaller bites, or we use a special cup that only delivers a certain volume. Those are the things that you might do and we'll talk more in depth in the next couple slides about some other swallowing strategies we might use. And then you might do that respiratory muscle strength training. It's especially effective for people who have difficulties fully closing their airway off. So that would need to be visualized with one of those studies we talked about. But if that is a problem and it's causing you to have food or liquid slip down the wrong pipe, respiratory muscle strength training might help that airway to close better. There are also newer things on the market that are device facilitated swallowing therapies. They work, all three of them, on a mouthpiece that you put inside your mouth, and then it gives you some biofeedback about the pressure of your tongue. Your swallow is a system of pressures, and it starts with your lips closing, your tongue to the roof of your mouth, your soft palate lifting up, your throat coming together to squeeze, your voice box lifting to let the esophagus open or the food tube open. So this whole system of pressures, if there is a loss of pressure somewhere along the way, sometimes strengthening within the mouth can actually help strengthen the throat as well. So the action of lifting the tongue, because the tongue, is a very intricate muscle, depending on where you put this sensor, you can exercise the back of your tongue, you could exercise the side of your tongue, you could exercise the front of your tongue. And so your speech pathologist might recommend some kind of device like this. There are also other wearable devices out there that are not on this slide that you can kind of attach to kind of see how much muscle energy you are using when you're swallowing, as to try to increase the muscle activation when you're swallowing. Okay, so let's talk about what some of those modifications might look like. So it could be a postural change. Maybe it's tucking your chin down to your chest when you're swallowing. That helps to kind of deflect material to the back of your throat if things are going down the wrong pipe. It could be a maneuver, like we said, the effortful swallow, swallowing hard. It could be that you have to hold your breath and swallow. And some of these are complicated actions, and so they may or may not be the right strategy for you, depending on how you are able to execute the maneuver. But they are available and sometimes can help train someone so that they can keep the food or liquid out of their airway by completing one of these maneuvers. You can also change the consistency. So if red meats are really hard to swallow because they're very tough, you could soften things, right? Maybe instead move to a ground meat, or something that's pressure cooked so that it's very soft. It could be put in a blender. Maybe chewing is a problem. And so, you want to always think about what's the most efficient way to get calories in. You want to make sure that you maintain your nutrition or hydration, or you could have other health issues based on not maintaining your nutrition or your hydration. It could be about thickening the liquid consistency. While we try to limit this and have this strategy be something that's, probably maybe one of the last things that we try, it can be an effective strategy of putting a thickener into a liquid to make the liquid flow back slower and have a little bit more cohesiveness to what you're swallowing. Volume control. It could be about just not taking such a big sip or such a big bite. There are actual adaptive devices like cups and straws that deliver only a certain amount of liquid. So you could sip through a straw, and let's say it only delivers a teaspoon at a time or a little over a teaspoon at a time. That would be an adaptive device you could use if, it was deemed that smaller sips were safer for you and you didn't feel you could kind of keep that small sip size on your own. There are also cups that when you tip them up, it only delivers a certain amount and you have to put the cup down before you can, take another sip in order to help with volume control. Those things can also help with pacing. If you're a really fast eater and part of the problem is just that you're eating so fast, it's causing coughing and choking, sometimes just pacing can also be helpful. And remember to limit distractions, right? If you're having swallowing difficulties, when you're eating, eat. It's okay to have some conversation during your meal, but pay attention to what you're doing. Try not to be eating and talking and watching the TV and answering your phone or scrolling. Try when you're eating to pay attention to eating. Some of the things that happen in speech and swallowing are really a function of this lack of dopamine that we talked about. And so that there are two systems that we have. One is called the extrapyramidal system that kind of controls the messages our nerves get. And one is called the pyramidal system. And so the extrapyramidal system is an automatic system. And so that automatic system doesn't function well with this lack of dopamine or that chemical that sends the messages to the brain and to the muscles. And so a lot of times trying to circumvent that system by working in the intentional system, we get a better outcome. So sometimes the act of swallowing, of just paying attention, is intent. Some other things to think about with swallowing: it's really important to have good oral care, especially if you're having trouble from time to time with things going down the wrong pipe. Keeping your mouth very clean and cleaning your mouth before you eat and drink can help reduce the bacteria. The food is not necessarily what causes a pneumonia if food or liquid gets down the wrong pipe. It's that the food acts as a carrier and it picks up the bacteria that's in the system of your mouth and throat and then carries that into your lungs, and it's not supposed to be in our lungs. And so that can sometimes cause the respiratory difficulties for swallowing problems. Also, importance of oral care is that it can reduce the risk of cardiovascular disease and stroke. So having really good oral care is important, and it's also good at maintaining the health of our teeth. Our teeth are so important for chewing, and while many people can chew without their teeth, this is something that makes chewing a little easier. And let's talk about drooling now. So drooling is a sensory-based issue typically. While it might feel to the person who's having the drooling that it's like an overactive salivary gland, it's actually just that the body doesn't sense that there's saliva to be swallowed as frequently. And so again, we talk about some of these sensory changes that happen within the body. It's like a lack of awareness that there's a lot of saliva until it's almost too late. So sometimes it's, you don't realize that saliva has pooled in the mouth until after it's running out onto the lips. And then you get the sensory information from the lips or the outer face that, oh, now I'm drooling. Things that can be helpful. Keeping an upright posture, right? Gravity is our friend when we're trying to keep the saliva in our mouth. If you are safe to, have gum or candy or something in your mouth, keeping that stimulated can help your saliva swallows. And if you swallow more frequently, it doesn't pool up in there. Again, if you're having significant swallowing problems, this is not going to be a strategy for you. That would be dangerous. You could lose control of that mint or gum and it could slip down the wrong pipe. That could be serious. So only do that if you're recommended to. Some people use external cues. They find something like a smartwatch or a smartphone or some kind of alarm system that kind of reminds them to swallow more frequently. I think there are some wearable technologies I've heard that are, maybe coming to market that might give you, like, you might wear it somewhere, on the neck or on the side of the neck, and then it might give you a little buzz when it wants you to swallow. So if you can't remember on your own to swallow, use an external cue of some kind of alarm system that might give you a cue to swallow so that it reduces your drooling. I know drooling is a really big impact for many people socially because you don't want to be out in public and be, drooling at a restaurant or out and about, and you have to always wear, some people almost feel like they need to wear a bib or have a washcloth all the time where they're constantly dabbing. Also talking to your doctor about medication management. There are medications that can be just prescribed as well as Botox injections for saliva. So, talking to your doctor about that could be also an option. Let's talk about strategies for cognitive communication. Let's see how, oh boy, I'm going to speed up here because I have a few more things to get through. I didn't realize the time. So cognitive communication therapy is about strategies that you use to help yourself. For memory strategies, maybe it's you use a mnemonic device to remember people's names, or you have to use repetition, or it could be the use of an alarmed pill box. So important to take your meds at the right time. Getting an alarmed pill box might be something that gives you an alert so that you don't forget to take your meds. There are so many smartphone apps out there to help you with your memory, your organization, and some of these things can also help with your motivation. I say often to just make an appointment with yourself to do things. Like you would make an appointment for yourself to go to a doctor's appointment. Well, make an appointment with yourself to do your home practice. Make an appointment with yourself to go for a walk outside. If it's something you kind of want to do, but then you lack the motivation to do it, setting some kind of very regular schedule and trying to stick to it for the most part can be helpful when you're having trouble with that motivation or memory piece. Quickly, let's just talk about tips for effective communication. Easier to talk to someone when you're speaking face to face. Have important conversations when you're well rested. You don't want to talk about a really serious issue when you're feeling really fatigued at the end of the day. If you're a caregiver or a spouse or family member, allow the person with Parkinson's time to speak and formulate their thoughts without interruption. Try not to speak for them unless they ask you to. I know oftentimes some of the frustrations that come is that people try to repair kind of a deficit in communication but sometimes the person with Parkinson's can do it themselves. And so just allowing them that extra time can be helpful. The other thing would be reduce background noise. When there's a lot of background noise, sometimes that can create distraction. This is something that I think is really important. Don't pretend to understand. Oftentimes, the person with Parkinson's can sense that you didn't really understand, and so then they don't feel seen or heard. Rephrase what you think you heard if you're not sure you got the message right. Just rephrase it to them and say, "Did you say this?" Remember that rigid facial muscles impact facial expression. And so sometimes people will be misread in their emotions because of this lack of facial expression. And so just remember to try not to read into those facial muscles, because a lot of times it creates what others perceive as like a seriousness, or that they could be mad, when oftentimes that isn't how they're feeling. So ask the person how they're feeling. Speak clearly and concisely to them, short, if they're having issues with memory or processing, just being clear and concise, not using a lot of extra words, can be helpful. Find ways to repair the communication breakdown. Maybe it's that you think about what you're going to say and then you say it out loud. Maybe the communication breakdown is that you reduce the distraction in the background, and just be patient, because it can be frustrating on both ends. Some things you can think about for voice care. I'm going to go through this one really quickly. Stay hydrated, limit caffeine and alcohol. They're drying to your voice box. Try to warm your voice box up before you're going to use it for the day. If you have heartburn or reflux, try to manage that, because that can affect your voice. Avoid throat clearing. All of those throat clears are little mini like slams together of your vocal cord and can create irritation in the voice box. If you're a smoker or a vapor, that is not good. That smoke or a vapor going across the vocal cords dries out the vocal cords. And then just try not to strain your voice. You don't want to feel like you're straining. Where can you find an SLP? You can be in a hospital outpatient clinic, a university clinic, private practice. Some therapists come to you and go in your home, and there are also telehealth clinics. You can get a referral from your doctor. You can call the Parkinson's Foundation and they can help you find some resources to find someone in your area. You can look at the LSVT Loud or Speak Out provider list. Both their websites have trained providers. You can go to ASHA, which is the American Speech Language Hearing Association. They have a pro finder, so you can look in your area, and they also have specifics on what people are trained in, or you can use good old-fashioned Google. All right, quickly, since I am a telehealth therapist, I'm going to go over this really quickly, but I do see the benefits of telehealth. And just thinking about how, if you might just not want to go because you don't want to go to a clinic, try to seek out a telehealth clinic, because you can do this in the comfort of your own home. It provides you greater access to care, eliminates your travel expenses, it'll reduces your travel time, it's convenient. It can be enhanced privacy if you're not in the waiting room and people walking back and forth. You don't need to wear a mask. Fortunately, none of us are wearing them as much anymore, but sometimes we do still need to wear them. And then it's, improves public health and safety when we're not all together all the time in a group waiting room. Things you might need for telehealth: a computer, a laptop, a tablet, a smartphone. Most devices now have a built-in camera of some kind, or you could have an external camera. It would need some kind of audio capabilities. You'd need some kind of microphone. Most of those things are now built into most daily devices. You'd need some kind of internet access or cellular data on your device. A good internet connection so that you could stream almost like a Zoom call to do your sessions, and probably an email address or a text message to receive your links to log in, and a quiet and secure location. All right. I think we have a little bit of time left for questions.
Thank you so much, Carrie. Really appreciate
Sure.
that of sharing that you offered to us in this really important subject that in many ways impacts our quality of life and living with Parkinson's. I'm also very grateful for the work that you've done in your professional career. It's so appreciated. So thank you.
Thank you so much. It's been a pleasure. I love my job. Makes it easy.
It shows. It shows, absolutely. I want to acknowledge for our viewers here that through the presentation that you so eloquently offered us, Carrie, that a lot of the questions that came through were answered. So I'm not going to ask Carrie those questions as they've been covered through the live presentation. We do have a couple of questions with our time remaining, Carrie, that I'd like to get through. Our viewers, Blake and TJ, are kind of in alignment with the questions that they asked and are curious about learning daily exercises that we can do to prevent rehabilitation. And it's twofold. So what are some practical ways to encourage better swallowing and speech? So what can we do day to day to prevent rehab that can also encourage healthy speech and swallowing?
That's a great question. So, I think just trying to use what you have, like use it or lose it a little bit, is really important. Just like I feel like there's always a big push for the physical aspect of kind of using your body, those same things apply to our speech and swallowing. And so trying to put forth some extra effort, it doesn't necessarily mean shouting, it just means be more intentional about how you speak, to like use your lips and tongue more. When you're swallowing, put the bite in. Think about swallowing as it's going down. I know it seems like sort of this mind body connection, is part of the issue because it's really a sensory problem sometimes, or it's really about firing up the nervous system.
Mhm. Yeah. It sounds to me that there is this level of mindfulness when we are speaking and eating that can come into being a tool of this idea of encouraging healthy speech, swallowing, and preventing some rehabilitation.
Absolutely. And if you feel like you're not ready for speech therapy yet, but you want to just kind of see what one of the programs are, you could go to the free Facebook Parkinson's Voice Project. They have lots of YouTube videos and they have that daily Facebook practice that you can join. And, so you could just pull up a video from YouTube from the Parkinson Voice Project, and that's who created the Speak Out program. And they have a huge library of 20-minute exercise programs for your speech that you could learn.
Great. Sounds like there's lots of resources available to us online. So thanks for
Yeah.
sharing. Our viewer Tom wants to know more about respiratory strength. What are some exercises we can do to improve respiratory strength? He's specifically asking if swimming is a good option for respiratory strength.
So swimming's a great option for respiratory strength, right? I think just fitness in general is good for our respiratory muscles. If you feel like you need to target your respiratory muscles more specifically, I think going to like some kind of device facilitated model might be a good path. But I think just in general, keeping up with your respiratory strength by just doing cardiovascular exercise, go to a boxing class, or, go for a walk or swimming, any of those things that kind of work the cardiovascular system would be good.
So keep it up, Blake and TJ, and our viewer Tom, who wants to do that respiratory strength training. In the same vein of respiratory strength training, Amy is asking, does respiratory muscle strength training require a specific referral from a specific provider?
So it doesn't require a specific referral from a specific provider. I'm sure that your neurologist could refer you for that if that's something you're interested in. I think the main thing is just, even if you are thinking about doing it, I would meet with the speech pathologist just to go over that list of contraindications. And then if there is something on the list of contraindications, then oftentimes your speech pathologist will kind of facilitate a conversation with whomever is referring to say, do you think, for example, I had a patient who I was recommending respiratory strength training. They received neurologic clearance from, their doctor, but then now we're also going to talk to their primary care doctor to make sure that from a medical side, it's okay, because it does increase your blood pressure and it increases like intracranial pressure as you blow through it. So while it's not extreme, there are some medical things that are contraindicated.
Thanks for answering that question for Amy. One of our viewers, and I really appreciate this question. They're wondering why people with Parkinson's do not perceive their voice accurately. What causes this misperception of softness or loudness of their voice?
Yeah, it's really a sensory based, like neurologic problem. And it's like really that the body doesn't sense that it's low in volume. Um, so, it has to do with the lack of dopamine, I believe, and that, the difference between the extrapyramidal and the pyramidal system. And that extrapyramidal system just does not sense with that lack of dopamine that the output is what the output is.
Thanks, Carrie. It's 1 minute after the hour, and we'll ask maybe one or two more questions before we close out.
Okay.
Let's see here. We've got a good question from Jane, and you had mentioned it briefly in your presentation, talking about clearing the throat. Jane says, I seem to have to clear my throat all the time. Why?
Yeah. Well, I think there's a variety of reasons that someone might clear their throat. It could be about dryness. A lot of medications that people take have drying side effects. And so that drying side effect can be, part of the reason that it's dry in the throat. And so people feel this sense of needing to clear their throat. Sometimes it can be habitual. So sometimes it's just almost like a crutch, if you will, that before you start speaking, you just go, because it makes someone feel like maybe they can get their point across a little bit better. It's almost like they shake off the vocal cords to like get moving. And maybe it's a little bit of a like that stiffness that we talk about. And so it's almost like it provides like a positive reinforcement often. Like the brain senses like there's stiffness there, but it's about to get going. And so going kind of like shakes it awake a little bit, but that's not the best way. I would say the best way to try to avoid throat clearing is to take a sip of water and swallow it hard, or take your swallow of your saliva. Like try to start replacing the behavior with something else so that your body doesn't keep getting this positive reinforcement of the throat clearing.
Thanks for speaking to that, Carrie.
Mhm.
And our final question from Patricia, they're sharing that they have trouble with the swallowing exercises. They feel like that they're freezing when they're doing them, especially with the hard swallow practice. Could you speak to this for just a moment?
Sure. Many people have trouble with those more traditional swallowing exercises because the act of actually having to try to get the swallow going can also be impaired. So it's actually like the message to the brain to trigger the reflex to swallow can be impaired. And so it can be hard to do those exercises when you're asked to do 10 of these and 10 of those, and you can't fire the system. The system's kind of feels like I just swallowed. I don't need to swallow again, right? And so because it doesn't sense you need to, it makes it much harder to trigger the reflex. Sometimes if, maybe just doing like taking your tongue and kind of trying to move it around in your mouth, something like that can help get things going. Or otherwise, you might consider trying to go to one of those device facilitated kind of models. Sometimes they can work on all the areas of swallowing that you're having trouble with, but you do it from a little bit different way. You're doing it through a tongue press. And so you're not actually swallowing during the exercises. You're working on strengthening the muscles
Mm.
from the onset of the swallow.
Interesting. Thank you for
Mhm.
sharing and speaking to the difficulty of the swallowing challenges. Really appreciate you, Carrie.
Yeah.
Want to send a thank you to everyone who was able to join us today, and Carrie again for offering your time and your knowledge in today's Wellness Wednesday. Want to share that the Parkinson's Foundation hosts weekly education and wellness programs through our PD Health at Home virtual programming. You can join us for Mindfulness Mondays, Wellness Wednesdays, and Fitness Fridays. Next week, we are having a special event for our social engagement series called Exploring Music Therapy for Parkinson's, presented by the Bluegrass Parkinson's Alliance. We'll explore 3 impactful music therapy programs: Drums Alive, Sentimental Journey, Therapeutic Choir, and Harmonic Basics. So in next week's session, we will experience each program firsthand and understand the unique benefits they offer for individuals living with Parkinson's. So this program will not be recorded to encourage participant engagement. So if you're interested, you better join us live. However, most of the PD Health at Home programs are recorded and posted on the Parkinson's Foundation's YouTube channel. You can scan the QR code on the screen to connect to our YouTube channel. You may also find out more and register to attend our live PD Health at Home programs at parkinson.org/pdhealth. So we did get a couple of questions today that were not able to be answered. Please know that we are here for you. Reach out to our helpline at 1-800-4PD-INFO or email us at helpline@parkinson.org. And before you go, as we end the webinar, your Zoom screen will prompt a survey. Our programming is fueled by your feedback. I read through all the comments and suggestions that you each provide to us. So please take some time to offer us some inspiration for our next calendar year's programming. Until then, take care, and we will see you soon at the next Wellness Wednesday. Be well, my friends.